Hello and welcome to Chapter 5, Medical Terminology. You're going to learn a new language in this lecture, and really what you're going to learn is the components of that language. You're not really learning the whole language itself, but once you learn the components, you can then learn the whole language and decipher the language itself. So this is going to be a short lecture. It's not meant to cover every single term or attempt to get you to memorize every single term. It's more of an attempt to just kind of give you the ideas of how words are put together in medical terminology and the medical language. So we're going to talk about medical terminology. We're going to look at the language of anatomy and physiology, and we're going to also look at some anatomic terms. So, components. Compounds are made up of two or more words. So smallpox, it's made up of small and pox. All right. Words that are made up from parts. So there's roots, and then you combine those root words with other things, with prefixes and suffixes and combining forms and various other things. Okay, so again, do not get overwhelmed. As long as you can understand the components and the different things that go into making the medical terms, then you're good. Okay, you can figure out the language. So therm is heat. Okay, so then we're going to use a combining form such as O and meter. So thermometer. Okay, so what do you think it does? It measures heat. Prefixes such as dis and tachy, those are both. So dis is a difficulty, tachy is fast, and penia, which is that root word, means breathing, okay, or breath. So difficulty breathing, dyspnea. Tachypnea is, or tachypnea, however you want to say it, is fast breathing. All right. Suffixes are those combining forms that go at the end of the root word. So suffixes like arthritis. Arth is bone. Itis is, or joint. Itis is inflammation. All right. Hemophiliac. Iac is a form of like talking about a specific person, and hemophilia, or hemo, is blood. Hemophilia is blood. Okay. All right. So let's word component example. So we've got tachy, which is fast, cardia, which is heart. So we put those two words together, and we get tachycardia, and that's a fast heart rate. Okay. Hemo, which is blood. Thorax for chest. Hemothorax is blood in the chest cavity. Okay. Cardiologist. So we've got cardio, which is heart. Logi, which is the study of. And ist is someone who specializes in. Okay. So think of some other specialists. So like a gastroenterologist, a endocrinologist, a pulmonologist, a neurologist, all of those people. So acronym. Acronyms are an abbreviation made up of initials that can be pronounced as one word. Okay, so CPAP. CPAP, we pronounce it CPAP. And it's continuous positive airway pressure. Another one that you'll see later on down the road in the assessment lecture is sample. So sample is signs and symptoms, allergies, medications, last oral intake, and pertinent medical history, or past medical history, whichever one you want. So sample is one of those words. MONA is another word, acronym that paramedics use. We use it for in cardiology, where it stands for morphine, oxygen, nitro, and aspirin. So MONA is another one. Okay, those are all acronyms. Abbreviations are letters or symbols used in place of words or phrases. DNRs. Okay, so do not resuscitate. Patient is PT. Various other things. ASA is acetylsalicylic acid, which is aspirin. Okay, so all of those things, each service and each system is different in how they want to do abbreviations and what abbreviations are acceptable. So when and when not to use medical terms. Do not use when speaking to patients or family members. They don't understand it. It's going over their heads. I mean, there's a whole chapter in your book dedicated to learning medical terms and how to learn those medical terms. So using those big, huge, long, overcomplicated medical terms will just confuse your patients, and you're not really helping them, okay? So occasionally complex terms used in messages can cause confusion, even among trained healthcare professionals. So if you go to one system and you use a word, they've never used that word, because, you know, just like soda and pop. Okay, let's take that for an example. So soda is used in, like, what is it, the South, and pop is used up north. So you've got two different dialects, but they mean the same thing. You've got two different words, but they mean the same thing. Okay, it's just like medical terms. It's medical language. You go to the South, they use one word. You go to the North, they use a different word. All right. That also goes into abbreviations. Okay. Those abbreviations can be termed differently in different areas of the country too, and in different services. All right. So if there is a potential for ambiguity, do not be reluctant to return to simple terms. Whatever it is, you know, just say it simply. Okay. All right. So we're going to provide a basic overview of anatomy and physiology. Okay. So anatomy is the study of body structure. Physiology is the study of body function. Okay. So anatomic terms. We've got directional terms, anatomic position, which is the facing forward, hands at the side, palms facing forward. We're also going to divide the body into planes, midline, which is an imaginary line all the way down the center of the body. Medial is closer to that midline. Lateral is farther away from that midline. Okay, so those are both directional terms. Medial, closer, lateral, farther. Okay, bilateral means that both sides are affected, or it's on both sides, or however, whatever it is, it's both sides of the midline, so the left and the right. Unilateral is one side. So say you've got a stroke patient who has weakness on one side. You would label that patient as having unilateral weakness on the left side. The mid-axillary line, this is an imaginary line that runs from the armpit all the way down the middle of the side of the body. Anterior or ventral is the front. Posterior or dorsal is the back. Superior is above. inferior is below. So remember our divisions in our body planes. So if you split me down here this way and then split me halfway at the waist, you've got both of those. Superior is above, inferior is below. So yeah. Proximal is closer to the torso. Distal is farther away from the torso. Palmar refers to the palm of the hand. Okay. Plantar refers to the sole of the foot. All right, so remember body regions and anatomic positions. So these are just body regions of the body. Okay, so we've got the pelvis, the abdomen, the thorax, the head, torso, the lower extremity, which includes the part of the pelvis, the thigh, the knee, the leg, the ankle, the foot. And then you've got your upper extremity that includes the shoulder, arm, elbow, forearm, wrist, and hand. Okay. So again, this is midline right here. All right. So midline goes straight down the body. Okay. Proximal goes towards that midline. Distal goes or closer to the torso. Distal goes away from the torso. Lateral goes away from the midline. Medial goes towards the midline. And then you've got this mid-clavicular line. This mid-clavicular line is an imaginary line that runs on each side of the chest. So we divide it up even further. So that way we've got points of reference. When we go into cardiology, you'll learn why this is important. So posterior is the back, okay, anterior is the front, superior, okay. So remember, we've got this imaginary line that goes across here too, okay. So superior is above, inferior is below, all right. And then you've got this mid-axillary line that goes all the way down. So that mid-clavicular line divides the chest into regions. Since there are two clavicles, there are two mid-clavicular lines. All right, so remember we talked about those planes of the body. So we've got the frontal plane, which is the front half of the body. And this kind of goes into the that mid-axillary line type deal where it goes all the way across. All right. And then you've got the transverse plane, which divides the body in half, and then your sagittal plane, which divides the body in half this way. Okay. So in our abdominal quadrants, we have horizontal and vertical lines through the navel. So you've got your right upper quadrant, your lower upper quadrant, your right lower quadrant, and your left lower quadrant. And then you can see, here's our lines right here, okay? That was bad. Yeah, that was totally bad. So you've got your lines right here. And you can see what is in each of those quadrants. Okay, so this helps us, gives us a reference to determine a little bit more about what is going on in the stomach. It gives us a reference on how we can determine what pain may be causing, what organ may be causing pain for that patient as well. Okay. Supine, these are positional terms. So supine is the patient laying on their back. Prone is the patient lying on their front. Recovery is the patient on side. And this is preferred for any unconscious non-trauma patient. Okay. Again, this is supine. Prone This is the lateral recumbent or recovery position. This is semi-Fowler position. The patient's at like a 45-degree angle. Feet are out. Okay. Fowler, the patient is seated straight up. Semi-Fowler, the patient is leaning in a semi-seated sitting position. All right. So chapter review. I told you guys it wasn't going to be a very long chapter. I told you it wasn't going to be like super long. We were just going to talk about all of the things that go into it and how to kind of dissect those words and learn that language. There is more in your book. There's more practice online in the Pearson VUE. So in your My Brady lab. So go on those things, do that work, make sure that you read your book. And the more that you get into medicine, the longer that you're in it, the more you can dissect those words and understand what those words are. Okay? So let's do some review. So medicine has a language all of its own. As an EMT, you'll frequently communicate with medical professionals who speak this language. We don't all go into it. Doctors don't even like specifically say these things because they have to remember that they're speaking to their patients as well. So they have to be able to, I wouldn't say dumb it down, but speak on a level that they understand. Medical terms generally consist of a root with a prefix and or suffix. Okay? Medical terminology is the language of the healthcare. Roots, prefixes, and suffixes can lend clues to the meaning of many words. Remember, tachy is a suffix, dis is a suffix, and then iac or ology or ist, all of those are suffixes. Okay. Understanding anatomy and physiology is like reviewing the owner's manual for the body. Anatomical terminology brings a precision and accuracy to descriptions. Okay. All right. So let's think about this. You respond to a teenage boy who has taken a hard fall from his dirt bike. He has a deep gash on the outside of his left arm, halfway between shoulder and elbow. Okay. So we're somewhere right in here, right? And on the other side of his right arm, just above his wrist. Okay? Right arm. Right arm. Okay, so just above his wrist. His left leg is bent at a funny angle, about halfway between the hip and the knee. When you cut away his pants leg, you see a bone sticking out of a wound on the front side. How will you describe your patient's injuries over the radio to the hospital staff? Okay, so you need to be precise, but you also need to keep out unnecessary words. All right, so in this patient, hold on. So in this patient, you've got a wound up to the left arm, a gash over on the right side just above the wrist, and bone sticking out of a wound on the front side. So on this patient, I would say that I've got a male patient who has a laceration to the upper arm, a laceration on the left side, a laceration to the lower arm on the right side, and then I've got an open wound with bone on his leg. It doesn't say which leg. So on his left leg. We'll just say his left leg. So I just keep it simple. It doesn't necessarily have to be like, especially in a radio report. All they want to know is where are the injuries, what side of the body are the injuries on, and can we fix them, okay? Because that's what they're thinking. All right, so questions, comments, You can email me, text me, call me. I'll answer those. And I will see you in the next lecture.